بسم الله الرحمن الرحيم. Welcome to ERA. I am Dr. Muhammad Talat with you, Assistant Professor of Radiology, Cairo University. Today we will start our course, Emergency CT Brain course, and I would like first to invite you to see or to watch our previous video checklist for the CT Brain. And this is our case for today. Let's go to our cases. During our teaching course, we will describe many signs, many teaching signs, many teaching points. Also, we will describe or identify some secrets in reporting. I would like, or I hope you can enjoy our course, inshallah. This is our first case for today, CT brain for a child falling from a height. So this one is a trauma case. We have a large extra-axial collection in the right frontoparietal region. I would like to emphasize this sign. Look for this one. Beside the collection, we can see widened CSF space beside the collection. This one, we can call it CSF cleft sign. CSF cleft sign means that we are dealing with an extra-axial lesion. Of course, this one is an extra-axial collection, hemorrhagic collection in the right frontoparietal region. And this collection shows convex inner border. So we have this collection, we can call it oval shape, lentiform shape, or sometimes we can call it biconvex. All of this one indicates that we are dealing with extradural hematoma. If we need to describe this one, we can call this one, we have a large extra-axial or extradural hematoma. And this extradural hematoma exerts mass effect in the form of indentation of the underlying cortical side, compression of the right lateral ventricle. For sure, the right lateral ventricle is compressed. Look for this one. This is the right side, and this is the left side. Look for the bodies of the lateral ventricles. Also, the collection exerts mass effect in the form of midline shift. We should measure the midline shift. We should draw line across the midline and another line perpendicular to the first line, connecting the foramen of Monroe, this point. Let us draw it by red point. This is the degree of the midline shift. We can draw a line from the foramen of Monroe to the line crossing the midline, or the line from the compressed third ventricle to the line crossing the midline. So we have midline shift around 1 centimeter. And we should measure the extradural hematoma. The extradural hematoma measures about 3.7 centimeter in its thickness. This one is very important, 3.7 centimeter in thickness. Also, it measures about 7.6 centimeter. So we have two dimensions in the axial plane, 3.7 times 7.6 centimeter. We should also measure the craniocaudal dimension. Let us. So it measures about 8.2 centimeter. So we have 3.7 times 7.6 times 8.2 centimeter. We should multiply all of this times 0.52. Why we are multiplying all of this times 0.52 to measure the volume? The volume here will measure about 119 cc. Why we are measuring all of these dimensions? Because we have the indication for surgery for interference if the volume of the hematoma, of the extradural hematoma, more than 30 cc. If the thickness more than 15 millimeter. We have here 37 millimeter, 3.7 centimeter. If the midline shift more than 5 millimeter. So we have here all the three parameters indicating that this child need surgical interference. So before starting your report, you should hold your phone and call the neurosurgeon that I have an urgent case, and you can inform him by that. We have also one of our secrets today in our reporting. In this case, look for this one. What is these pockets? For this one, you can see inside the hematoma some pockets. Look for this one. Hypodense pockets inside the hematoma. These pockets most likely indicates what we called swirl sign. Swirl signs indicate active bleeding. So we have a large extradural hematoma with an active bleeding. Also, in the coronal plane, I think the coronal plane is not so proper, but there is suspicious of subpalcine herniation. Look for this one. Below the phalanx cerebri, I think there is a suspicious crossing of the brain tissue from the right side to the left side. But to be honest with you, the image is not so good to confirm this sign. We can see it later on, inshallah, in many cases. Okay, so if we review our checklist for the CT brain, because we don't want to be satisfied. Okay, we should go from outside to inside. From the outside, you can see small subgaleal extracranial hematoma also in the right posterior parietal region. We should check the bone. Look for this one. This is a coronal suture on both sides. This is a lambdoid suture on both sides. So don't miss this one and don't misdiagnose this one as a fracture. But if you go slowly, you can get this small line here indicates this one is a fine fissure fracture in the right parietal bone, and this one should be confirmed in the 3D image. Again, we need to identify this hematoma. If you see this hematoma, this one doesn't cross the sutures. This is a lambdoid suture, and this is a coronal suture. So this is one of the teaching points in the extradural hematoma. It doesn't cross the sutures, but it can cross the midline. Okay, extradural hematoma occurs secondary to injury of the middle meningeal artery, and the blood collection occurs or located between the inner table of the calvareal bone and the outer layer of the tibia. This is in brief what we have in our case today. And by the end of this first case, I would like to invite you all, if you have any comments, positive comments, negative comments, anything you want to modify in the next cases, I'm happy to listen to you. And inshallah, I hope that these cases will be beneficial for you. Thank you so much.